You look in the mirror and see a bulge behind your knee. You think, just another varicose vein. I'm getting old. That assumption is dangerous. If that lump feels like a water balloon, it is not a vein. It is a ticking time bomb called a Baker's cyst. And if you treat it like a vein, you could end up in the emergency room tonight. Imagine a water balloon popping inside your leg. That is exactly what happens if you ignore this or treat it the wrong way. When a Baker's cyst bursts, the fluid rushes down into your calf muscle. Your leg turns bright red. It swells up massively. It feels hot to the touch. The pain is sharp, sudden, and absolutely terrifying. Here is why this matters right now. A burst cyst looks exactly like a deep vein thrombosis, a blood clot. A blood clot can kill you. A burst cyst won't kill you, but it hurts like crazy and mimics a life-threatening condition. You end up rushing to the ER terrified, spending hours waiting for an ultrasound, only to find out you could have prevented the whole mess weeks ago. You need to know what that lump is before it pops. You need to know if you are walking around with a grenade behind your knee. So how do you tell the difference without an expensive doctor's visit? You can do a simple check right now. We call it the water balloon test. But before we get to that test, I need to tell you something critical. There is one specific stretch, a movement you probably do every single morning to loosen up, that is actually crushing that cyst and bringing you inches away from a rupture. I'm going to reveal exactly what that dangerous move is and the safe alternative at the end of this video. You need to stop doing it immediately. First, let's figure out if you actually have this condition. Think about a varicose vein. Veins are like squiggly lines. They look like a blue road map under your skin. If you touch a vein, it feels soft, maybe a little spongy, but it collapses easily. It feels like an empty garden hose. You push it, and the blood moves away instantly. It doesn't fight back. Now, think about a Baker's cyst. It is not a tube. It is a pocket. It is a sack of fluid. Think of a garden hose that has sprung a leak. The water pools on the driveway and forms a puddle. That puddle is the cyst. Reach down and feel the back of your knee. Does it feel like a distinct lump? Does it feel like a grape or a small plum under the skin? That is fluid. It has tension. It pushes back against your fingers. Here's another sign. Stand up straight. Lock your knees back. Does the back of your knee feel tight? Does it feel like there's something stuck in the hinge of a door? That is the fluid getting squeezed. Drop a comment below. Does the back of your knee feel tight or full when you fully straighten your leg? I want to see how many of you are dealing with this pressure. If you feel that pressure, you are feeling the cyst. A vein will rarely stop you from straightening your leg. A cyst will physically block the movement. It takes up space. It's pressure, and that pressure is a warning sign you need to listen to. But why is it there? This is where most people get it wrong. They think the cyst is the disease. They want to cut it out or drain it with a needle. Here's the truth. The cyst is not the enemy. The cyst is the messenger. Your knee joint is basically a car engine. For the gears to move smoothly, you need oil. In your body, that oil is called synovial fluid. It lubricates the cartilage so your bones glide instead of grind. When you have arthritis or a meniscus tear or just years of wear and tear, your knee starts to panic. It thinks, I am grinding, I need more protection. So it starts producing oil. Lots of it. It overproduces synovial fluid to try and save the joint. In fact, a study published in the Journal of Rheumatology confirmed that in 94% of cases, a Baker's cyst is directly caused by an intra-articular disorder, meaning a problem inside the joint itself. The cyst is just the symptom. But your knee is a closed container. It has limited space. When the engine floods with oil, that fluid has nowhere to go. The pressure builds up inside the joint capsule. Eventually, it finds the weakest spot in the wall. That weak spot is almost always at the back of the knee, between the two heads of the calf muscle. The fluid pushes through that weak spot and balloons out. That is your Baker's cyst. It is literally an overflow tank for your knee's engine oil. If you just stick a needle in it and drain it, but you don't fix the engine problem, the tank will just fill up again tomorrow. You have to understand the mechanics to fix the leak. Now, let's confirm you actually have this with a professional grade test you can do in your living room. Doctors use a diagnostic method called Foucher's sign. It sounds complicated, but it is just a simple observation of physics. Try this. Stand up, make sure you are near a wall or a sturdy chair for balance. Lock your knee straight. Reach back and feel the lump. When your leg is straight, the fluid is trapped. It is under high pressure. The lump should feel rock hard. It might feel like a bone or a hard golf ball. It feels solid because the door to the knee joint is closed, trapping the fluid in the balloon. Now, the second step. Sit down on a chair, bend your knee about 45 degrees, relax the leg. Reach back and feel the spot again. If it is a Baker's cyst, the lump should suddenly feel soft. It might even disappear completely. Why? Because when you bend the knee, you open up the space between the bones. The fluid flows back into the joint. The pressure releases. The door is open, and the overflow tank drains back into the engine. If it is a solid tumor or a vein issue, it usually stays hard or doesn't change much, but a fluid sac changes based on the position of the door, your knee joint. If it's hard when standing and soft when sitting, you almost certainly have a Baker's cyst. Safety first. Stop immediately if you feel sharp pain or lose your balance during this test. Talk to a clinician if you have balance issues, but for most, this is the gold standard home test. Once you know you have it, the next question is always, should I put ice on it? We have been brainwashed to put ice on everything. RICE. Rest, ice, compression, elevation. That was the rule for decades, but for a Baker's cyst, ice is often the wrong move. Think about the fluid inside that cyst. It isn't water, it's thick, sticky engine oil. If you ice it, you are turning that oil into sludge. You are freezing the drain pipe shut. To empty the tank, you don't need ice. You need flow. You need to melt the jelly so it can move. If you take a jar of honey and put it in the refrigerator, it becomes impossible to pour. It crystallizes. It gets stiff. That is what you are doing to the fluid behind your knee when you slap an ice pack on it. You are increasing the viscosity. You are making the fluid thicker and harder to move. You want this fluid to leave the cyst and go back into the knee where it belongs. You need flow. Instead of ice, you usually want gentle heat on the muscles around the knee to loosen things up, followed by gentle motion. You want to warm up the oil so it becomes thin and runny. That is how you get the engine to circulate properly. Ice numbs the pain, sure, but it locks the fluid in place. We want to move it out. So how do we move it out safely? We need to turn your leg into a pump. We need to mechanically encourage that fluid to leave the back of the knee. We need to create a vacuum effect. We need to gently open and close the joint to milk the fluid out of that back pocket. The best way to do this is an exercise called the heel slide. It is low impact, safe, and very effective. Lie down on your back. You can do this on your bed or on a rug on the floor. Legs straight out. Try slowly slide your heel along the bed toward your buttock. Bend the knee as far as is comfortable, do not force it, then slowly slide the heel back out until the leg is straight. Imagine your leg is a piston, in and out, in and out. This rhythmic motion does two things. First, it lubricates the joint, telling your body, hey, we're moving smoothly, you can stop panicking and making so much oil. Second, the bending and straightening action acts like a milking machine. It gently squeezes the fluid out of the back pocket and pushes it back into the main chamber of the knee. It's simple mechanics. If you appreciate tips that actually fix the mechanics instead of just masking the pain, hit that subscribe button right now. I share the stuff that actually works for us, not the stuff that sounds good in a textbook. Now, aim to do this for 1 or 2 minutes, nice and slow. If you feel pain, make the movement smaller. Don't pull the heel all the way in. Just get the motion going. You can also add ankle pumps to this. While your leg is straight, point your toes away from you, then pull them back toward you. Pump your ankles up and down. Why does this help? Your calf muscle acts as a secondary heart. When you pump your ankle, you are squeezing the deep veins and the lymphatic vessels in your lower leg. This creates an upward suction. It helps clear out old swelling and fluid from the lower leg, reducing the overall congestion in the area. Combine the heel slides with the ankle pumps, and you have a complete drainage system working for you. This leads us to a massive mistake I see people make when they go shopping. You might think about buying a knee brace. You walk into the pharmacy, you see the aisle of beige elastic sleeves, and you grab one. Be very, very careful. Most of those generic compression sleeves are just tubes of elastic. When you pull them on, they squeeze everything equally. If you have a bulge behind your knee and you put a tight elastic band over it, you are creating a tourniquet. You are trapping the fluid in the cyst. It's like putting a clamp on that garden hose leak. The pressure has nowhere to go, so it pushes harder against the walls of the cyst. This can actually cause the cyst to burst. I have seen it happen. People wear a tight sleeve to support the knee, and they end up making the injury explode. If you need support, you must look for a sleeve that has an open patella, an opening for the kneecap, or, more importantly, a cutout or softer fabric behind the knee. You need a popliteal cutout. Never let fabric bunch up in the knee pit. If the fabric wrinkles and digs into the back of your knee, take it off. You are making the balloon bigger. You want compression on the swelling in the joint, not on the escape valve at the back. Look at the back of the brace before you buy it. Is it the same thick material as the front? If yes, put it back. Is it a thin, silky mesh? That's better. Is there a literal hole there? That is the best. You need to give the cyst room to breathe, not suffocate it. Now, let's talk about something we all do, sleeping. Believe it or not, how you sleep can make your Baker's cyst significantly worse by morning. Many people with knee pain like to sleep with a pillow under their knees. It feels comfortable. It takes the pressure off the lower back. But if you have a Baker's cyst, this can be a trap. When you sleep with a pillow under your knee is bent at about 30 degrees all night long. Remember the mechanics? When the knee is bent, the door is open. Fluid flows into the cyst. If you keep it there for 8 hours, the fluids settle. But the bigger problem is stiffness. If you keep your knee bent all night, the muscles and the capsule tighten up in that shortened position. When you wake up and try to stand, your leg doesn't want to straighten. You force it straight and you put immense pressure on that fluid-filled sac. Try to sleep with your legs relatively straight if you can, or if you must use a pillow, make sure it is a thin one and try to do a few gentle heel slides in bed before you stand up in the morning. Get the oil moving before you put weight on the engine. This brings us to the insider knowledge regarding your diet. You might think, what does food have to do with a lump behind my knee? Everything. Remember, the cyst is caused by the knee producing too much fluid because it is inflamed. Inflammation is the fire. The fluid is the water the body uses to put out the fire. If you are eating foods that increase inflammation, sugar, processed flour, fried foods, you are pouring gasoline on the fire. Your knee stays inflamed. Your body keeps producing excess fluid. The cyst never goes away. You need to lower the systemic inflammation. This triggers a process called specific resolution. Think of it as your body's internal fire department finally getting the signal that the emergency is over. Try adding natural anti-inflammatories to your routine. Turmeric is a powerful one. Omega-3 fatty acids found in fish oil are another. In fact, a meta-analysis of 17 randomized controlled trials found that omega-3 supplementation significantly reduced joint pain and morning stiffness in arthritis patients. By cooling down the inflammation from the inside, you stop the knee from overproducing fluid. You turn off the tap. Once the tap is off, the cyst can finally drain and shrink. Now, let's close the loop on that dangerous stretch I warned you about earlier. This is the most critical part of the video because this mistake is so common and so risky. I told you there is one move that crushes the cyst. It is the classic hurdler's stretch or the standing toe touch where you lock your knees. You know the one. You stand up, lock your legs straight, and lean forward to touch your toes. Or you sit on the floor, legs locked out in front of you, and reach for your feet. You do this because your hamstrings feel tight, and they probably are tight, guarding the injury. Why is this bad? When you lock your knee and lean forward, you are engaging the hamstring and the calf muscles at the same time. These two muscles cross behind the knee like a pair of scissors. The Baker's cyst sits right between them. When you do that locked leg stretch, you are closing the scissors. You are pinching the cyst between your bones and your tight muscles. Imagine stomping on a juice box. That is what you are doing to the sac of fluid. That is how you burst it. You apply hundreds of pounds of leverage directly onto a thin-walled sac of fluid. The fix: you can still stretch your hamstrings, but you must change the angle. Always keep a micro bend in your knee. Never lock it out completely. Put a small rolled-up towel under your knee if you are sitting on the floor. When the knee is slightly bent, the scissors are open. There is space for the cyst. You can lean forward and stretch the muscle without crushing the fluid sac. It feels less intense, but it is safer and actually targets the muscle belly better. Think of it this way. You want to stretch the muscle, not the joint capsule. By unlocking the knee, you take the tension off the nerve and the cyst, and you put it on the hamstring belly, which is exactly what you want. This gives you the flexibility to tie your shoes or pick up your grandkids without risking a rupture. Finally, we need to talk about the red flag, the when to run moment. Most Baker's cysts are annoying but not deadly. They come and go with your arthritis flare-ups. If you treat the knee, lose a little weight, strengthen the muscles, do your heel slides, the cyst will often shrink on its own. But you need to watch your calf like a hawk. If you wake up one morning or you finish a walk and your lower leg suddenly swells up, if it turns red, if it feels hot like it's radiating heat, if the pain is constant and throbbing, not just when you move, do not do heel slides. Do not massage it. Do not try to walk it off. Go to the doctor immediately. It could be a burst cyst, which is painful but manageable, or it could be a deep vein thrombosis, a blood clot. They look identical from the outside. You cannot tell the difference by looking. An ultrasound is the only way to know. If it is a clot and you massage it, you could dislodge it. If that clot travels to your lungs, it becomes a pulmonary embolism. That blocks the oxygen supply to your body. That is life-threatening. I am not trying to scare you, but I want you to respect the swelling. If it's just a lump behind the knee, use the tips in this video. If the swelling moves down the calf and gets hot, get professional help. Let's do a quick recap of your action plan to keep you safe. 1. Check for the lump using the water balloon test, Foucher's sign. 2. Avoid the ice. Remember the honey in the fridge analogy. Use gentle motion instead. 3. Use heel slides and ankle pumps to create a vacuum and clear the fluid. 4. Check your knee brace. Make sure it has a cutout in the back. 5. Avoid the hurdler stretch. Keep a micro bend in your knee to save the juice box from being crushed. 6. Watch for the red, hot calf. Stay safe, keep moving, and remember to treat the knee, not just the lump. Check out our other great video about bulging veins behind the knee. Watch out for a Baker's cyst, and tap the card on your screen now to keep your joints happy and healthy. Wait, before you go, I want to address one more thing that usually pops up in the comments. Can I just ignore it? You might be thinking, it doesn't hurt that much, it's just a lump. Can I just live with it? Technically, yes, you can live with it. A Baker's cyst isn't cancer. It's not an infection. But ignoring it is like ignoring the check engine light in your car. Sure, the car still drives, but whatever caused that light to come on, the low oil, the overheating, the grinding gears, is still happening. If you ignore the cyst, you are ignoring the cry for help from your knee joint. The cyst is a symptom of instability. If you ignore it, the underlying arthritis or meniscus tear usually gets worse. The wobble in your knee increases, and as the wobble increases, your mobility decreases. You start walking less because it feels weird. When you walk less, your muscles get weaker. When your muscles get weaker, they support the knee less. The knee grinds more. It produces more fluid. The cyst gets bigger. It is a vicious cycle. The lump is your opportunity to break that cycle. So when you see that lump, don't just say, "I'm getting old." Say, "Okay, my knee needs some attention." Start with the heel slides. Look at your footwear. Are you wearing old, flat shoes that offer no shock absorption? That increases the impact on your knee, causing more fluid production. Maybe it's time for new sneakers with good arch support. Look at your hydration. Synovial fluid is largely water. If you are dehydrated, the quality of your joint lubrication drops. It becomes sticky. Drink more water to help your body produce high-quality oil. And look at your movement patterns. Are you twisting your knee when you get out of the car? Are you pivoting on a planted foot in the kitchen? These small twisting motions irritate the meniscus, which triggers the fluid flood. Try to move your feet with your body. Turn your whole body. Don't just twist the knee. Small changes add up. I also want to touch on aspiration. That's the medical term for draining the cyst with a needle. Many of you ask, why doesn't my doctor just drain it? Doctors are hesitant to drain Baker's cysts for a very good reason. The recurrence rate is huge. It's almost guaranteed to come back if the underlying knee issue isn't fixed. Imagine bailing water out of a sinking boat but not plugging the hole. You bail the water out, you feel better for 10 minutes, and then the water rises again. Plus, every time you stick a needle into the knee area, there is a tiny risk of infection. An infection in a knee replacement or a damaged knee is a disaster. So most good doctors will say, let's treat the arthritis. Let's do physical therapy. Let's try a steroid injection into the knee, the engine, not the cyst, the tank. If they calm down the engine, the tank empties itself. That is why the exercises I showed you, the heel slides, the ankle pumps, are so valuable. You are doing the work of draining the cyst naturally, safely, and essentially for free every single day. Let's go deeper into the ankle pump because I think people underestimate it. I mentioned it acts as a secondary heart. This isn't just a figure of speech. Your heart pumps blood out to your toes, but your heart is a long way from your feet. To get that blood and the lymphatic fluid back up to your chest against gravity, your body relies on the muscles of your legs. The soleus and gastrocnemius muscles in your calf contain large venous sinuses. When you flex your foot, these muscles contract and squeeze these sinuses, shooting blood upward. When you have a Baker's cyst, that area behind the knee is congested. It's like a traffic jam. The fluid in the cyst is pressing on the veins. This makes it harder for the blood to get out of the lower leg. This is why many people with Baker's cysts also have swollen ankles. By doing vigorous ankle pumps, really pulling the toe up and pointing it down, you are manually overriding that traffic jam. You are forcing the flow. Do this while watching TV. Do this while reading. Do this when you first wake up. It is the easiest way to decongest your leg. And speaking of decongesting, let's talk about elevation. We mentioned RICE earlier, and I told you to avoid the ice, but the E, elevation, is still your friend if you do it right. Most people get elevation wrong. They put their foot on a footstool. That is not elevation. That is just sitting with your legs straight. For elevation to work, your foot needs to be higher than your heart. Gravity needs to help the fluid run downhill towards your core. Lie on the couch and put your leg up on the armrest or a stack of pillows. But remember the extension rule. Don't let the knee hyperextend. Bend backward. And don't keep it bent at a sharp angle. A soft, slight bend is the sweet spot. If you can do this for 15 minutes a day, combined with the ankle pumps, you are giving your body a massive advantage in clearing out that old stagnant fluid. I want you to think of your knee health as a long-term project. It's not about fixing it by Tuesday. It's about keeping you mobile for the next 20 years. The Baker's cyst is a warning light. It's annoying, it's ugly, it's uncomfortable, but it is useful. It tells you when you have done too much. If you go for a hike and the cyst swells up the next day, that is data. It means that hike was a bit too much for your current joint strength. It doesn't mean you can never hike again. It means you need to build up more quad strength to support the knee before you try that distance again. Listen to the cyst, respect the cyst, but don't fear the cyst. Unless, of course, it turns red and hot. Then you fear it and you go to the doctor. I really hope this deep dive has helped you understand what is going on behind your knee. It's not magic, it's mechanics, and you are the mechanic. You have the tools now. You know how to check for it, you know how to pump it out, you know how to stretch safely. Take control of your mobility. Don't let a pocket of fluid dictate your life. If you found this helpful, please share it with a friend who has been complaining about knee pain. You might just save them from a rupture or a misdiagnosis. And one final tip. Consistency is key. Doing heel slides once a week won't do much. Doing them for 2 minutes every morning and every evening will change everything. It lubricates the joint before you start the day, and it drains the joint after you finish the day. Make it a habit like brushing your teeth. Your knees will thank you. Thanks for watching, and keep moving forward.